Good morning, good morning. Please come in, welcome. It's 1 minute after. We have a crowded room today. We want to start on time. Let me set my timer. There's the role of the moderator.
Would you like any water?
Oh, please.
Okay. So welcome, everyone. Thank you. And people will come in as we are talking, so just welcome. I'm Bobby Jefferson, and I'm Vice President. I'm Head of Diversity and Inclusion, and I've done technology work at DAI. I'm also on the SID board and chair of the DEI committee and supporting CREED. People have heard of CREED, the Coalition for Racial? Great. And people have heard of the working groups at SID as well? Great. So as part of my welcome, please come in. Everyone, we'll try to keep this interactive. We'll try to keep this dynamic. It's early in the morning. First part of the conference. Hey, Elizabeth, hey there. I'm going to call out people, if you don't mind. So thank you, everyone, for being here, for being present for this Inclusive Development Global Health panel. Many of the global health folks are at the World Health Assembly in fancy Geneva. And we are here today to be able to talk about what does it really take to do inclusive development. And we've got a great panel of speakers. But before I get started, I do want to thank the SID board and Wade and Ann Simmons and Katherine Rafelson. And I want to give a special shout out to the working groups. So are there members of the Inclusive Development Working Group? There you go, Ryan. Thank you for this. The Health and Nutrition Working Group, are you here? There, please stand up, please, Health and Nutrition Working Group. As well. And why is that important? Is because I want each of you to be involved. So one way to be involved in SID is to be involved in the working group. So this is an inclusive development panel, global health, so you have an opportunity to actually get involved. And the other thing that we did mindfully is that we made sure we did an outreach to the HBCUs. So we outreach to the historically black colleges and universities in the area to provide them free access to this conference. And so thank you to the sponsors and others for that, because that's our commitment on a go-forward basis. So this topic is all about not just health, not just outreach, not just locally led development, but how do we practically do this work? I've been in health, supporting health, for at least the start of PEPFAR. And so back, supporting the community in Nigeria, Kenya, Haiti, and many other countries. But how do you ensure that people with disabilities and our LGBTQ+ colleagues and our racial and ethnic equity colleagues and all of us who, there's a famous mantra of nothing about us. Thank you. And so we're going to talk about what does that mean, not to do things without us. And so the name of this conference is Power Shift. And so how do we now shift that power? And what does it mean? So I've got a great panel of USAID folks who are willing to, share their experiences, share some practical guidelines. They have a few talking points as well that I think will be important. So the way this will work is I'll give each of our panelists and speakers 2 to 3 minutes just to introduce themselves, a little bit of their background, and then I've asked them to share with you something interesting. And I'll start, what that means, I'll start off myself. So that way, at the end of the day, you can at least remember us as a panel, because you've been through a lot of panels, a lot of presentations, but you remember what someone said or how you felt. So again, I'm Bobby Jefferson, I'm the moderator for today, and what I want to share with you is that I have 2 kids, twins, who graduated from American University. Yes. And my daughter now works in Australia, working with the First Nations Aboriginal individuals and people, doing public health work. And so what I didn't realize when I first started this 20 years ago, I never would have guessed, is that this work and passion that we do for development can be passed on to the next generation. And so I'm a living monument to that. My kids now are taking up that mantle. So if you can remember anything about me, at the end, just remember that I'm passing it on, and I want to help the next generation. So now I want to turn over to my fabulous, wonderful colleague, Tambra, to just give her brief introduction and share something about herself.
Thank you for that, Bobby. So his introduction is, honestly, this is my first time meeting him, and he definitely creates that feeling of inclusion by providing that warm welcome. And being a student at American University, doing a PhD in communication, specifically media tech democracy, focusing on belonging, he's created that belonging, and I hope we can continue that energy today about how do we truly make everyone feel valued, welcome, accepted, and cared for, because to me, it's not enough to be included, it's about how do you feel while you're being included. And so that's a feeling that I want to have us to have today. So in terms of the key points of what are memorable things that you can take away from me, if nothing else beyond inclusive global health, my top 3 things that I'm proud of, I guess you can say, one, I'm a first generation college student, but 5th generation Oklahoman, and I was the first born natural security education scholar on the DS at Oklahoma State University, where I graduated from with my undergrad in human nutrition, pre-med, and Spanish. That took me to Dominican Republic to do global health work, and that's how I caught the bug to be in this space. And the second, I was the first African-American woman to receive an MA in Media Technology and Democracy this past December at American University, which basically, if anyone is interested in analyzing Trump's tweets as a threat to democracy, that's our space, digital media scholars. So I'm pursuing a PhD to continue to further understand how our society is impacted by technology, but specifically Black women belonging in online communities and how that flows into improving their health or not, by looking at women's health organizations and how they're operating with these digital tools. And lastly, the third thing I'm proud of, I received a design patent to create a little Wanda doll because we need a champion for food and especially for African food. And so it took 2 years in the making, but she's a talking doll, and the goal is post-pandemic is to help manufacture and put in the hands to inspire that next generation of food heroes and carry out our mission as well to complement our books, which are created in English and African languages like Hausa, Swahili, and Amharic, and take them to children abroad in Africa. So.
Great, thank you. Wow. All right. All that for you social entrepreneurs out there. Let's during the Q&A. Okay, let's turn over to Jesse.
Well, that's a tough act to follow. My name is Jesse Patterson. I use he, him, his pronouns. I'm the Senior Policy and Health Equity Advisor at USAID in the Bureau for Global Health. I've been with USAID for about 12 years. I've done a variety of functions at USAID, from desk work to HIV/AIDS advisor, and currently I'm working on DEIA and the Global Health Bureau, both infusing those principles in our workforce, so identifying unconscious bias and doing recruitment events. I also went to an HBCU event a couple weeks ago to do some recruitment.
Which one?
Tennessee State.
Tennessee State, all right.
Yeah. To do some increasing recruitment, because one of the things that we've noticed in the Global Health Bureau is that while we do have some diversity at the lower classifications, as we get higher up, that kind of dips off and become a little bit more homogenous. So we're doing some deliberate efforts to do some recruitment in that space. But also, my position also looks at localization and inclusive development. So making sure that we're thinking about shifting that power to local organizations in our global health programming. Something interesting about me, so I also went to school in DC. I went to Georgetown University. Any Hoyas out there? And I got my bachelor's degree in nursing. So I actually worked at a Washington Hospital Center in the emergency department for several years, and that's where I get my passion for health equity, because at the core, nursing is about addressing health equities. And so that's been a driving force, even when I was in non-health positions, working on the desk in South Sudan or Sudan. It's always been in the back of my mind. It's something that's really driven me forward. So that's my interesting thing.
That's very powerful, Jesse. Thank you for that, especially the nursing background. My dear colleague, Kathy.
Hello, everyone. Can you hear me okay? Yeah. Great. You thought you had a tough act to follow. So good morning, everybody. I'm Kathy Guernsey. I'm the agency Disability Rights Coordinator here at USAID. I am not the only person who works on trying to ensure that our overseas development and humanitarian assistance is inclusive of persons with disabilities. But I am the focal point. So all complaints, please direct towards me. I am a public international lawyer by background. I used to say that I was a recovering lawyer, and when I worked for Judy Heumann, she used to say, "Stop saying that, you haven't recovered at all, what are you talking about?" I should perhaps also explain my accent a little bit. I was born in Ohio. My dad was from Ohio. My mum is British, and we moved to the UK just before I was 2 because my mum prefers the weather there. Ohio is a little bit extreme temperatures for her. She said she wanted to be able to leave the house for more than 2 seasons a year without risking death. Too hot in the summer, too cold in the winter, and tornadoes in between. So I did all my schooling in the UK through A-levels and then came back to the States because I knew I wanted to be a lawyer in the United States, whatever that meant, and came back when I was 17. So my accent is a bit weird. I like to say I may talk funny, but I spell properly, but my colleagues may debate that when I throw in words like whilst and amongst, just to see if I can get it through clearance. Thing that I'm proud of, it's every public international lawyer's dream to have the opportunity to participate in a treaty negotiation. I'll be honest, I thought I was going to go off and do environmental law. And I, very early in my career, had an opportunity to work at a small NGO that was trying to take a more rights-based approach to their work with landmine survivors, and joined there right as the negotiations for the Convention on the Rights of Persons with Disabilities was beginning. And to their credit, they said, well, this is something we can do. We can give the technical support of our legal staff to try to help marry the vision of the disability community with the technical reality of global international human rights language. And so I was fortunate enough to be able to participate in all of the negotiating sessions for the CRPD, which is what hooked me on disability work, I'll be honest. It was an immersive experience. Wow. And I've often described it as being sort of like the Matrix. Once you see it, you can't unsee it. Once you see discrimination and marginalization and oppression, you can't unsee it. And I was fortunate enough to be working with people like Judy Heumann and other incredible advocates. And I said, gosh, the environment's really important, but there's over 1 billion people here. And there's so much to be done. We can make a difference. So I won't take credit for the treaty, but I will say it's participation in that was something that I will always hold with me.
Well, you make me want to binge The Diplomat again, so.
Anyway, back to you.
Okay, so what we'll do is we'll allow the panel to just share some few points, and then we're going to leave at least 10 minutes for audience Q&A, so please gear up a few questions, and questions do end with a question mark, as opposed to comments, and so we'll be able to facilitate that as well through our colleagues. So my first question really is for Tambra. When we talk about this power shift, and we talk about shifting resources into the hands of local leaders. So what has Wanda done? Just share a bit about that in your perspective. That would be great.
Yeah, so I think adding context of how Wanda started, because it may inspire many of those who are disgruntled inside their organizations and looking for ways to flee. I won't name any names, but I worked for an international NGO at some point in my life. But before that, I was very passionate still for domestic work. And so in my mind, I thought, I started my career at Health and Human Services, coming out of Tufts Med. I did an MPH in health communication, and I thought I would, develop campaigns to change people's lives and behavior, and then I saw how politics quickly erodes that sense of naivety of me, and went on working for more federal agencies, commerce, in minority business, and then local government, on women's policies, victims issues for the mayor here, and then went on to be an extension agent doing nutrition education in the community, because in your 20s you want to feel like you've cut your teeth onto something, you can put your name that you've made an impact. And so in this iteration process, I went back to my Boston days learning about social entrepreneurship, going over to Harvard to their social enterprise conferences, and remember that if I want to see that change, I have to be that change. And so while working for an international NGO, I was, doing backstopping on, nutrition initiatives for around the UN, and it's through the white papers that I saw a gap. And that gap was understanding the role that hyperlocal women can play, as everyone else wants to be with the big wigs, but the real teeth on the ground of how do you work in the community. And so I thought about my own experiences being in nutrition, the only Afro-American in my program back at Oklahoma State, and said, what can I do with this disgruntledness? I can create something versus being on the sideline and complaining. And so that is where I formed the NGO WANDA, which is Women Advancing Nutrition, Dietetics, and Agriculture. I wanted to create a space where women, Black women like me, who no matter if you are on this side of the Atlantic, if you see the scene of Color Purple, which the remake is coming out, and they ran across the field, that's how I wanted to see WANDA, about women coming together and bringing food as a form of peace and community, and being able to see themselves as the food heroes that our community needs, at a time when men became chefs, taking our power and platforms and privilege and profit, and saying actually it's our grandmothers, our mamas, our aunties, our nanas who really understood what it means to heal through the power of food, and we must honor and uplift them when they were the hidden figures in the food system, like our African foods were the hidden, forbidden indigenous crops that now everyone wants to own and have a piece of the pie. And so it's these two forces of seeing our food and our women needing to be acknowledged, and how do we advocate and change policy because we become informed ourselves. And so for us, it was laying that first vision down to know what our values are, and to then look at how do you operationalize that. Our three key pillars is educate, advocate, innovate, but also celebrate us as these food heroes. And this is why we have not only put on this third year in the row since the pandemic, the Sisterhood Supper during Juneteenth, which is an opportunity to uplift local food heroes, but also Mayor Bowser proclaimed that week as WANDA Week to celebrate the contributions of Black women in agriculture, nutrition, dietetics. And we went on to create an endowed scholarship back in Oklahoma at a time where there's anti-racist discrimination laws in place where you can't award based off race, and finding loopholes to be able to do the very thing that we acknowledge, that there's less than 2.5% African-Americans in the dietitian space in nutrition, and needing to change those numbers to create a more inclusive nutrition workforce. And so we've created funding where we're taking down that student loan debt relief and providing not only scholarships but mentorship and field placements for HBCU students like at Howard and other universities, so we can make sure that they see the representation that we want to see out in the world, and to know that we can be the change. We can be those queens of goddesses. We can be the advocates. And so that is why we're pushing forward a food bill of rights, not only locally and domestically. I serve on the DC Food Policy Council and USAID Area Advisory Board, but it's understanding that even Africa, how can we arm women with policy concepts that they can take to enable their own communities to become the environment that's not obesogenic, that's not a food apartheid, but it's one where they become food oases. And it starts by having women owning their voice, reclaiming their feminine power, and really taking root to say, I will be that change that my community needs.
Thank you. Wonderful, wonderful for that. I'm going to ask just a follow-up, but before I get to that, I do want to ask the audience, how many companies or organizations recognize within your organization's Juneteenth as well? Great. Wow, fantastic. And we just want to get a sense for how many are students. How many here are students? Fantastic. How many are from NGO groups? How many are health professionals? Okay, U.S. government, U.S. government folks? Okay, all right. Who did I miss? Anyone did I miss? I was just trying to get a sense for social entrepreneurs. Okay. Family foundations. Okay, people with money. There you go. All right, family foundations. Hey, let's come up here. You know.
Yeah,
So-
Wanda needs to eat.
So I'm going to ask my colleague Jesse about who represents the Global Health Bureau, is what is it that change look like, that power shift from a funding perspective and the global health perspective? That's what we're really interested in as well, because you control the dollars, you control the power as well. So Jesse, if you have a few words to share.
Folks will know that last year Administrator Power announced a new localization agenda, which set the benchmark of shifting 25% of our agency funding to direct local organizations. And right now, USAID writ large is about 13% direct funding. And that doesn't mean that that's trying to say that there's not a role for international organizations to play, but it's giving a greater voice to local partners via the power and funding. And so right now, like I said, the agency writ large is around 13% local funding, direct funding. The global health sector is a little bit better in that space, where we're at about 20% funding, direct funding for local organizations with our fiscal year 2022 funding. And that's really based off of promising practices that we've had in the HIV/AIDS space and tuberculosis and other sectors where it kind of lends itself to being more locally led. So in HIV/AIDS, as Bobby had noted before, engaging communities that are greater at risk for HIV acquisition, such as men who have sex with men, female sex workers. So in that space, and under the leadership of former Ambassador Birx, they've already kind of put localization as a primary initiative before localization was a sexy topic. But now, so moving forward, like I mentioned, so right now the Global Health Bureau is, the Global Health Sector is about 20%. And so what we've done is to kind of accelerate that achievement towards the 25%, we've created localization action plans for each of our technical areas. So localization is different from malaria, for tuberculosis, for HIV/AIDS, for family planning. It's different in every sector. So we've created localization action plans to encourage further localization where it makes sense. And we've also started planning for localization south-to-south meetings that will happen later this year. So we'll have one in Western Africa and then one next year in Bangkok, so that we can really share some best practices in our efforts towards localization. So those are some of the examples of shifts that we've made. To date, areas like tuberculosis has done really well. So in FY 2018, we only had about 4% of our funding going directly to local organizations, and by 2022, it's up to 42%. So we're making shifts and making strides in certain areas, but there is still a lot of work to do.
Great. I'm certain you'll get a lot of questions around localization, funding, and that type of question from many of the audience as well. So we're going from community to bureau, Global Health Bureau. Now we'll go to the top agency level. Kathy.
Thank you. So I want to preface my remarks by just taking a moment to pause. When we talk about the need for power shifts, I think it's important for us to take a moment to pause to see how has inequity manifested itself in the health sector, right? So the missing billion reports, there have been 2 reports, and then most recently the global report on health equity for persons with disabilities from the World Health Organization came out just in December. If you have not read these reports, please go run and read them right away. One of the statistics that I find just startling is that they noted that some persons with disabilities live 20 years less than other people. 20 years carved off of somebody's life, not because of some inherent medical condition that could be, to lead to higher levels of mortality or life-limiting health condition. This is because of systemic barriers, societal discrimination that has a deleterious effect on people's physical and mental health, problems with the health system itself, attitudes of people, not appreciating, not understanding the need for accessibility, for communication, taking people seriously, recognizing that they have a right to be in that system and to access those services and support on an equitable basis with others. I think we really need to pause, and it's not just persons with disabilities, right? We see very similar things across LGBTQI+ people, indigenous people. We have systemic issues that we need systemic responses for. And so the kinds of things that we are sort of giving consideration to are, how do we ensure that people have an equitable seat at the table to influence those systems, those resources, and those interventions? That means meaningfully engaging these communities, not just as stakeholders and users, but on the inside, how do we get our health systems to look like the people that they're supposed to be serving? How do we ensure that we have diversity in our health systems administrators, amongst our medical professionals, ministries of health, ministries of finance? How do we ensure that those perspectives are in there? We talk a lot about diversity, equity, inclusion, and accessibility because we need to, right? We need to make sure that we are infusing these systems with these diverse perspectives. We need to ensure that these communities are able to shape the legislative, regulatory, and policy frameworks that set up these systems. And that they're also engaged in monitoring and holding these systems accountable, right? And budgeting, money. How do we influence how money is spent in a way that will result in more equitable provision of services? And these are all areas where we as development professionals have a role to play in intersecting those different issues to the extent that we have influence over them through our programming, through the policies, for stopping and saying, hold on, something's not right, and we need to ensure that the people who should have a voice in those decision-making processes really have that. And that's where inclusive development and localization marry together to create a virtuous cycle so that we can achieve nothing about us without us. Or, and that was a phrase started by the disability community, the phrase they're using now is nothing without us.
All right. We're definitely going to be using that one as well. And I want to follow up just a few additional questions. So Tambra, with you have a strong grassroots movement. You're also involved with the diaspora. How do global organizations be able to partner or work with grassroots movements when they are not necessarily traditional partners of like USAID and others as well? So if you have any thoughts around how do we engage, how do we work together, what are some of the capabilities that grassroots organizations bring, like yours, to the table in global health, or bringing the voice, especially of Black and African American women, to the table?
Well, I love sharing resources, so I'll say one, I had the opportunity to hear the Global Fund for Women, President LaTanya Frepp speak this week in DC, and so I first encourage you to get the book Everyday Feminist, if you haven't already, that speaks to grassroots feminist movements and women like Tarana Burke, who led the Me Too movement, for instance. And then I would also say through my own personal story, before I miss the point, Zora, look at Zora's documentary on PBS, because when she was at Columbia University, after she had attended Howard, she was sent to be that face, trusted face out in the community to gather anthropological data from the community. But the community was like, just because you're Black don't mean that I'm gonna relate to you. And so I think there's something to be said about all skin folk ain't my kinfolk. And sometimes that's not widely said in our communities when we want to throw a Black face or a Latino or Asian face, but we saw what happened to Uber recently, so learn. And I would just say that from our own personal experience with Wanda, for instance, I went to do the work on me. So for instance, even though I'm from Oklahoma, I traced my heritage back to Nigeria, Fulani community, went back to reconnect to my own lineage, because I think part of those who do this work have to acknowledge a part of being to be a leader, you have to heal your own traumas around why are you not connected to the diaspora, because there are some who live here who've never gone back to their home country because of the trauma. And so that first, get a therapist. and for your organization to deal with these issues. And I say this because we, in our own communities, have had Black women fire Black women. And though this is a little bit off topic, it's very relevant because part of the white gaze, colonial gaze, is having this belief that we must uphold neo-colonial powers. And it's something that is a disservice to the work of shifting power if we're not shifting our mindsets. And that is something that you cannot prescribe. And so as I could go and talk about build trust, share resources, like that's so superficial, that's not substantive, that's not doing the work for us. And so it is doing that real divination kind of work. I mean, because when you work with communities like Global South, having my first stint in DR and working in West Africa and other places, spirituality, communalism, all these things that are opposite of Westernization has to be acknowledged and brought into the fold of the ethos that you operate from. And unfortunately, that's not always encouraged, or people are not brave enough in these safe spaces to say the obvious things that need to happen, that maybe you need to flip the paradigm on its head. But that's what needs to happen, that everything is not about documentation, it's about a feeling and intuition. And these are things that I find that is critical to our own work. So for instance, working with us, we always talk about slide coins, credit, and credentials. Like if you're coming with an extractive mindset based off imperialism, it's not gonna work. Just don't even send the email if you're not offering anything to the table. And so if you're wanting to write a paper about, you know, collecting data, like are you giving us the credit? Are we co-authorship in co-creating this? Also, if you want us to speak, are you paying that honorarium to have us speak? Because this work doesn't happen for free. And free ain't free. Hello, emancipation. And so, and credentials, like the thought of, even though my mom may not have a PhD or master's, like she's a very intelligent, smart woman because she has knowledge that is indigenous, knowledge that is just what it means to be a mother. You just evoke knowledge the moment you have children. I'm sorry, that's a degree within itself. And so for me, it's understanding like how we set the parameters of what makes something work or not work. And so our work in developing not only books and providing that to countries like in Nigeria is also working with schools and honoring, uplifting women, working with the Muslim Women's Association. I mean, the tight-knit community.
Especially
like
in
that
northern
is so
Nigeria.
critical. Exactly. Like if you don't have those kind of relationships, you can't really move forward a lot of ideas.
Thank you. I'm going to leave, I'm sure the audience, as do I, has more questions on that. And so I'm going to ask Jesse a question. But on my way to asking Jesse a question, just a plug for our global health colleagues. Please, as you collect your data from health clinics in Nigeria and Kenya and other places, give credit to the clinicians and the nurses, because I cannot tell you how many poster sessions and presentations I've seen where, especially our global health colleagues, they'll say, here's the data, I'm presenting it, I was in Kano, but they give no credit to where those actual data came from. So I just urge that us as global health professionals, please recognize and acknowledge where the data is coming from. And so Jesse, as I now turn to you, you know, a lot of the MSM and other type of work that I've done on the HIV side had to do with supporting LGBT, thank you, Ryan, Q+ colleagues. But there are countries such as Uganda that have now passed local labor laws. There are countries where it has made it, you know, in the Middle East and North Africa, where local labor laws make it difficult for both our colleagues to travel there and for us to help and support MSMs and others, and LGBTQ+. So what's been your perspective, or what guidance can you share around how we can, as a community, begin to address some of that, to be inclusive while still thinking about the issues around the local situation?
That's a tough one. No, so I think one of the things, and this kind of, I alluded to this earlier, is disengagement is not going to move the issue forward. I think that we have to rely on our State Department colleagues to continue the political conversations around advancing some of the issues that we want around gay rights or gender equality, things like that. So it's not disengaging from the people who are perpetuating some of these things, but making sure that the rest of the interagency that work and focus on these policy-related issues are engaging with their counterparts in these conversations. And so it's, again, in the DEIA space, you can't progress any of our initiatives without our majority white colleagues. We can't go anywhere without that. And that's, I think it's some people don't like to hear that, but it's essential. So you have to continue to engage with those folks and have conversations and keep the channels open so that you can move the issue forward. Sorry, that was a very concise answer to your question, but yeah.
No, I do appreciate it, because that's a reality of what we're facing today. And we're not facing it just in international, but also domestic in the US as well. And so, Kathy, you know, one of the areas around persons with disability and disability rights also has to do with funding. So I know that there's a lot, there is some earmarked funding as well. But from your perspective at the agency level, how do we go about getting it embedded across procurements and across, so it's not just in global health, and or when there's intersectionality, where there are people who are women of color, who are disabled, or people who have multiple intersections show up. So it's not just, you know, so how to address that lens as well, because I'm trying not to keep things in a narrow stovepipe. How do we make it much more broad?
Yeah, thank you. And your question comes at an exciting time for us. We are in the process of updating our agency disability policy. USAID was very proud to be one of the first bilateral donors globally to adopt a policy on disability and development in 1997. It hasn't been updated. So we're working on that now. That's something that hopefully this year we will get to see that. But these are exactly the kinds of questions we are asking ourselves as we look to establish a policy framework that we can then use to form the structure for then technical guidance across different issue areas. And I want to give credit to our education colleagues for really being ahead of the game on the technical guidance. But we're working with Global Health and others to make sure that basically everything that we do at USAID should be an opportunity for inclusion, not just of persons with disabilities, but of all marginalized groups. So in terms of how do we do this, I think practically, we need to stop being vague. Sometimes we use umbrella terms because we're afraid of leaving somebody out, and I'm all for non-exclusive illustrative lists, but we've got to get specific. We've got to say, who are we talking about? When we don't do that, it's too easy for groups who are already pretty invisible in these spaces to continue to be ignored. So we, as those who are engaged in procurement, we need to start getting really specific about who we intend for implementers to be including. And that means saying their names. So that's the first thing. I think we also recognize, and we're working on this now in terms of both educating our colleagues as well as our implementing partners, we've got to be proactive in our budgeting for the programming. We need to be asking those who are in the implementation community, when they respond to our solicitations, we need to see a budget that is reflective of proactively budgeting for inclusion. Now, in the disability context, that could be, are you budgeting for accessibility? Are you looking to hold your trainings in spaces that are physically accessible, where there's communication and information access? These can't be an afterthought, because all too often we find that everything else gets budgeted for, including the air conditioning and the laptops, and then a participant comes who needs to be accompanied by a personal assistant, or they need a sign language interpreter. We've got to be thoughtful about these things up front. And if that means ring fencing a certain portion of the budget just in case, let's do that. And if it's not needed, we can use it for something else. But we've got to be smart about budgeting in advance. These things have to be upfront, not as afterthoughts. And then data. We've got to be smarter about data, our disaggregation. How do we disaggregate our data? There's data that's in there, but people are hidden in the numbers. And we've got to be much more thoughtful and intentional in our disaggregation of data, so we can find out who's there and who's missing and where are the gaps.
Thank you for that. So now we're going to open it up for audience Q&A. And so if you have a question, this is the time. And so as you're thinking of your question, Pebbles, do we have microphones? Or otherwise, I'm happy to come down and share my microphone. Or you can come up here Oh, there's microphones. Just quick follow-up. I like the idea, love the idea, of having inclusive development as part of procurement, as part of the evaluation criteria, and as part of budgets. I think those three things will make a huge change. So, yes, so we have three questions. So, yes, Martine, and you can come up. You can,
They have microphones. They just need to come on up.
oh, you have, okay. You have mics? Great, thank you.
Thank you very
And
much.
please ask a question with the question mark.
Yes, Bobby, I have a question with a
Okay,
question
thank you,
mark.
thank you. All right.
Thank you very much for the esteemed panel. My name is Martine Lenny. I am the president of Alliance for Sustainable Development, that is a woman-owned small business here in the US, and a local organization in Cameroon. My question is for Jesse. As we think about localization from the local organization point of view, the challenge that I see is that many of the conditions USAID has put in place is trying to transform those local organizations into mini US businesses. And it's a big challenge because we are asking people to compete who never learn how to fight. So how many strings is USAID willing to unattach for localization to truly work?
Starting with an easy question.
That's a very easy question. As I mentioned, localization has been something that's been on our radar for some time, and it's created, it's gotten a lot more attention recently. One of the things that we've just announced, and I'm not the person to talk about this, but I do know that this has happened. They have revamped some of our procurement requirements so that it is a little. It's not. I hate the term lowering the barriers, but it's addressing some of the challenges that local organizations face around financial management that preclude their ability to get direct USAID funding. We've also revamped our website. We've made it available, some of the guidance in local languages. We've had some of the, we have videos that kind of walk people through some of the procurement processes. So those are some of the things that have happened to kind of address that. But I do think that there's still a long way to go to ensure that there's greater equity in terms of how we fund our global programs.
Great, thank you.
Could I add something real quick
Please,
to that? I think one of the things that we are seeing colleagues in the field realize, and it takes more effort, it takes more time, but sometimes we need to just reframe how we're holding our partners accountable. So milestones can be a really useful mechanism, and I have in mind, I won't name the country or the implementer, but we work with a lot of little organizations, right? Organizations of persons with disabilities are not the sorts of organizations that are usually well positioned to compete for USAID funding. We've funded groups who didn't have a bank account. And that's where we were starting from. And milestone number one was, let's help you get a bank account. And let's talk about basic accounting and basic administrative functions that can help that organization not only manage our money, but manage themselves in the future as well. So sometimes we have to be really real about what those milestones are and to change our expectations so that we're really helping and supporting people, not just crushing people under bureaucracy.
Great. Thank you.
Hi. My question is now
Sorry,
starting.
who are you from and where?
Siddharth Shah, Greenleaf Integrative. We work with how psychological trauma is part of the space of development and conflict. And we are so happy to be a member of CREED, the materials of CREED. If you don't know about CREED, find out about CREED. My question is sounding more like a follow-on question, and it's a little bit about resistance and the tactics or praxis that would come into helping the other side, unlearning privilege as loss. So much time, Tambra, your remarks, you represent resistance. And with resistance, there's counter-resistance for change.
Great.
And are there any elements of of best practices, tactics that you've seen, where compassionately you're addressing the power structures that are going to try to forestall your progress? Thank you.
Thank you for that. We'll let Tambra, we'll let Tambra start. We'll let Tambra start. Happy to.
Well, So I speak in taglines as the comms person. So the West is not the best and the rest of us is a motto that I've had to say in different countries I've had to visit on the continent. And it only informed me how important the work here needs to be done because the West is uplifted and glorified, of doubling down this sense of affirming indigenous culture. And so with this, the earlier example that I gave about, so there's an organization, we can say she's a woman of color who fires another woman of color, almost like a public lynching, puts her HR business out among the stakeholders, and one would say if she were white, we know we would have picket signs and everything else. So why was she given the feeling that she could do this because of white supremacy? It is okay to lynch people of color kind of notion. And so when you have that sense of counter-resistance, one of the strategies that we've taken on is one, obviously that person has been traumatized, it's obvious, because they would not have done that, and devalued their own selves to not see the humanity reflected in that person. And so having the one-on-one is what I've done, because everyone needs to be seen, heard, and valued. So even the person who's hurting other people needs to be heard. One, and then second, community roundtables. How do you bring the elder council kind of together to be able to have that discussion? Third is being able to bring that trauma-informed healer into the space to change, but also it needs to happen inside the organization, reflected in the policies and the practices and the procedures, and the promotion of it. And so this is real work. It's happening within the context of now, as Wanda is working with other organizations and affirming women who have been hurt, and there are those who are in leadership positions, they need to go through a leadership training. So the question is, where is the training to decolonize your approach to leadership, even if you're a woman of color? Because the Uber girl needs to be in there too. So this is what I'm saying, like, that's what it looks like.
Truth to power here.
But that's what needs to be happening. And we have to acknowledge our proximity to whiteness and that adjacency, what it does to uphold white fragility. It doesn't serve anyone. It actually hurts us, and it cuts lives. That's why the report is, you're cutting 20 years off your life, okay? And you working hard, not taking vacations, that's just a performative plantation. So get off the plantation, and that means start changing the mindset.
If I can jump in really
Yeah,
quickly to respond.
please.
So it took me a minute to kind of think of some of the examples that might speak to your question, because it's a good one, and it's a challenging one, because if anybody's familiar with USAID, it's hierarchical to the extreme. So how in the Global Health Bureau have we kind of challenged unlearning some of the powers of privilege? Even before, I guess in 2020, the Global Health Bureau actually dedicated some funds to diversity, equity, inclusion, and accessibility for staff. And so we've had a couple of projects that we've done to help staff kind of unlearn some of those behaviors. So one of those things, the products of this was we've come up with a Power of Words document. So the way that we talk about our aid is going to change. And we have words that we should replace. We shouldn't use words like
Beneficiary.
Beneficiaries, yes. We've gotten away from beneficiaries and stuff like that. Included in those guidelines are actually imagery guidelines. So what types of pictures that you take. Some of those images kind of reinforce some of the negative stereotypes of what we have about people in certain countries or certain situations. And we've developed some guidelines around that. We've also we've had what we've called leadership readiness sessions, and it's something that I helped kind of put together, where we've really identified a cohort of the most senior folks in the Global Health Bureau and had facilitated conversations. There were 6 sessions where we talked about what it meant in terms of inclusive leadership. Like, how do you empower staff? How do you make people have a sense of belonging and feel like they can be true to self? So we had that as well. And then the other piece, and this is more at the agency level, our Foreign Service nationals are the majority of our workforce. And those, how do I say this politically correctly, are the least empowered at our agency to have a voice. And they should be, because they should have the power because they're the ones who come from the countries in which we serve. And so our agency launched an FSN empowerment plan, and the Global Health Bureau is moving forward with so parts of those plans are increasing the number of senior FSN positions in agents in global health offices, creating fellowships so that they can do sort of rotations in the DC and get experience in the DC, or do rotations in other countries. And so really kind of focusing on traditionally what has a group of folks who have not been empowered to continue the career growth.
That's brilliant. That's brilliant, especially the FSN empowerment. So we have 3 minutes left. I don't mean to cut you off.
No.
I want to make sure we get the last 2 questions, so you both can ask us where you're from, and then we'll turn it over back to the panel. So.
Hi, I'm Sunita Sharma, Vice
Sunita.
President Health at Palladium. And it's like Bobby was talking about intersectionality. So when we work in countries, so when we are talking about marginalized population, and bringing the angle of poverty, like these people face really complex issues and need very comprehensive approach. So the points about right legal regulatory mechanisms, policy framework, financial protection, financing side of things, data, all of that really, really important. But one of the things when you're talking about accountability framework. So how we really make sure there's accountability ecosystem, people at all different levels, because it really needs action. It's not just about analyzing data or have the right policies in place, because if we really want to improve situation, it really needs action. And we need to hold people accountable at all different levels to make sure something happens, because people suffer every day, and it's really very difficult to see when we work in countries and all. So I just wanted to, any good example you have seen of accountability ecosystem, or how you would like to incorporate in our programs or technical assistance or localization efforts, that'll be really good. Thank you.
Thank you. Accountability. Next question, and we'll wrap up.
All right, great conversation. Thank you. Mehreen Ferg from Counterpart International. One of the lessons learned from the pandemic that we observed from some of our work in the Sahel and Niger was working with religious figures, cultural thought leaders. They wield a tremendous amount of local credibility, and they're able to message things within that culturally relevant paradigm. So my question is, what is our risk appetite of working with these locally credible thought leaders under the localization framework? Thank you.
Great. So who wants to take the accountability and then the inclusion around, because I know USAID has the religious and group as well, under Adam Phillips. So. Who would take the accountability? Yeah.
I can take a go at accountability.
Yes. Okay. Kath.
So I think the first thing is definitely we have to center in the work, in designing, in leading on the technical implementation of the populations in question, right? Again, nothing about us without us. But we need to hold ourselves accountable. And so we are working on, for example, and the name of it keeps changing, but a Know Your Rights. So if individuals, particularly individuals from marginalized groups, if they feel that that their rights have not been respected in programming, that there's a mechanism that they can trigger to let us know so that we can investigate and so that we can make changes depending upon the circumstances. That marries very well with our AAPSM to make sure that we're also ensuring that there's no actual abuse occurring in our programming context, but this is a corollary to that. So we recognize that we need to do more to ensure that even one individual who feels that they have been, that their rights have been violated in the course of programming, that there's a safety valve that they can come forward, possibly anonymously if they're more comfortable doing that, but it's accessible to them because we need to know so that we can hold ourselves accountable.
Great.
And I'll pass it off for the faith-based.
Yeah, I'll have to defer the faith-based one, but USA does have Adam Phillips, who leads the faith-based part of the work as part of the inclusive development. So I want to make sure to leave you time so you can have lunch. And so I just want to leave 30 seconds for each of the panelists just to give you their takeaway. So that way you can have something to take away with you as well. So Tamara, 30 seconds, please.
No problem. Cite Black Women, Kimberly Crenshaw created intersectionality. And then also go to iamwanda.org, get into our newsletter, sign up, make a donation. Reparations is real. And yeah, if you want us to come to an organization, speak around equity and leadership issues, slide into our DMs. Thanks.
Brilliant, brilliant. And don't forget to show the doll so we can. All right. Jesse, 30 seconds.
I just wanted to say that health equity can't be achieved passively. It requires intentionality. And so we have to be intentional in our funding, our partnerships, and then the people that we empower.
Brilliant.
We're sharing the agency brain cell today. I wanted to say the same. If we're not being intentional about inclusion, we're going to be, at best, unintentional about exclusion, and at worst, intentional about exclusion, right? We have to be thoughtful about this. And when we're not seeing it happen, hold ourselves accountable, hold each other accountable. As professionals, we need to speak up when it's not happening.
Great, thank you. So please give a hand to the brilliant panel. And feel free to ask for their business cards, LinkedIn, and to network. Thank you. Concludes this session.